You're hearing a lot about coronavirus in the news, even here at 9 on your side. North Carolina has its first presumptive case of the illness. But what is coronavirus? It's more common than you may expect, as Erica Mizell with Vidant Health News explains.
Coronavirus, as the name suggests, is a virus that causes a respiratory disease known as COVID-19.
It appears to be 80% of the time the infection appears to be probably no worse than a bad cold.
Symptoms include fever, cough, and shortness of breath.
Coronaviruses, there's a whole family of them, but basically they're the causes of winter colds. So if you've had a cold in the last 3 or 4 months, particularly the last month or two, you almost certainly have had a coronavirus strain.
According to the CDC, the risk of getting COVID-19 in the U.S. is currently low. But should a case arrive in eastern North Carolina, Vidant Health is ready.
They would be placed into what's called an airborne isolation room. And that's a room very much like this one here. When we close the door, it has multiple air exchanges per hour to prevent folks from acquiring infection.
To prevent the spread of respiratory diseases, including COVID-19, the CDC recommends you take the following steps. Wash your hands, including the tips of your fingers, for at least 20 seconds. Avoid touching your eyes, your nose, or your mouth. If you're sick, stay home. And if you have to cough or sneeze, cover your mouth and your nose with a tissue or use the crook of your arm. The CDC and North Carolina Division of Health and Human Services both serve as reliable sources of truth.
Well, the CDC website, cdc.gov, has got the most information.
Information to help keep the public safe, including right here at home. In Greenville, Erica Mizell, Vidant Health News for 9 on your side.